Hello, I'm Dr. Isaiah Fowler with the Infectious Disease Unit at the Centers for Disease Control, and I have been summoned here today to talk to you about edible vaccines, also known as plant-based vaccines. These vaccines are able to provide vaccinations in a very quick and efficient method, as opposed to traditional subunit vaccines. In his paper, Edward Rybicki brings forth the example of the hepatitis B vaccine, which was first produced in a very costly and inefficient method by taking infected blood samples from patients and creating the immunogenic proteins by hand with each sample. P. Lal et al. In his paper describes the traditional vaccines as being technologically intensive and extremely costly, as well as lowering compliance in children by needing to use a needle for administration. Now, edible vaccines allow organisms like plants to produce immunogenic proteins in large amounts themselves, rather than having to produce each protein in a lab. This is supported by Charles J. Ardson's article, Edible Vaccines. Now, the commercialization of edible vaccines is quite far in the future, but there have been animal tests done for cholera, but with the use of potatoes, tomatoes, and algae, with very good results, as described in the article by Concha et al. Now, there's currently a lot of debate as to, once the commercialization of vaccines has occurred, who should control the production of these vaccines, of these vaccinating plants? Well, it is my position, and I believe the morally correct one, that the governments of those receiving the vaccine should be the ones controlling, or at the very least have a say in the production of the vaccinating plants. Some may say this is a flawed point of view. By allowing one country to have control over another country's sovereign territory and things that they are not themselves producing. I say that you are looking at it from the wrong point of view. Dwayne Kirk provides the example that 46% of all vaccines are created in North America. However, 88% of all vaccines are sent to developing countries. This shows that there is a large disconnect from people producing the vaccines and those that are receiving the vaccines. What incentive do those that are producing the vaccine and not receiving the vaccine have to keep the quality high? Well, they don't really have much of an incentive other than a moral one. And in fact, they have a monetary incentive to lower the quality, as it would be less intensive to do so. These people are not receiving the vaccine, and thus they do not know what is best for the people that are receiving it. Only the fairly elected government, the people receiving the vaccine, knows what is best for their people. Those that are producing the vaccine should have to adhere to strict standards produced by the government of those receiving it for the most fair distribution of vaccinations across the world. If this was not the case, then it is likely that developed countries would get higher quality vaccines than those that are not. This advances citizens' power and the power of developing countries on the global stage by allowing them to express power over developed countries that they previously had not been able to do. These developing countries are receiving the vast majority of all vaccines and thus should have a say. This would work towards creating a more level playing field globally as well, by allowing developing countries a voice in the direction that the world is going and giving them more power on the global stage, which is, after all, an objective moral good. Allowing more people to speak out and have a say in the way that things are running is always a moral good. The sole authority of the production of vaccines being in the hands of an unelected government, of course unelected from the point of view of those receiving the vaccines, if they are not in the same country as those that are producing it, is an objective moral evil, as it is a human right, as is defined by the Human Rights Council of the UN, to be able to vote for those that be able to vote for any major decisions and effects that would have on your life. And this would strip them of their voice in affecting their lives, such as how vaccines are produced. This is doubly important with plant-based vaccines, as current tests with them show large variability in the dosage amounts administered from plant to plant, as is described by Dwayne Kirk's article. If the plants are not strictly controlled for quality, this could lead to some individuals getting ineffective plants that produce low immunogenicity. This could mean that while you eat the plant, you do not become immune to or become vaccinated from what the plant was intending to vaccinate you from. Those that would be more likely to get these effective plants or get the less effective plants would likely be poorer individuals in countries that are buying them. Thank you.